All right. Awesome, awesome. Timing was perfect. We're actually live right now, so this is good. Good
Yeah.
morning and happy Saturday. Good morning, good
Happy
afternoon, good evening.
Saturday. Yes.
And depending on who and who's watching, when you're watching, this is the voice and the face of Dr. Olabintan. I'm the CEO and the co-founder of Living Spring Family Medical Center here in the amazing city of Mansfield, Texas, very close to Dallas, for those of you who are wondering. And at Living Spring Medicals, we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. And so if you're watching live with us, hashtag live. For those of you who will be watching a replay, hashtag replay. Feel free to tag your friends and loved ones who could use this live because today we'll be talking about the topic, Doc, can infertility be cured? I've been trying. I'm happy to have our guest today. I'm a big fan of hers. I like her posts. I watch her. She may not know. I'm a silent stalker. And she is Dr. Oluyemisi Famuyyiwa. She's in fact, you know what? I'm going to let her introduce herself. So, Doc, thank you so much for coming. Please kindly introduce yourself. Who are you and what do you do?
Thank you so much. And let me tell you, Dr. Leviton, you are a favorite of mine, and I've been following you as well. I am
Thank you.
so honored and really so happy that you would call me today. I'm privileged. My name is Oluyemisi Famuyyiwa. I am the founder and medical director for Montgomery Fertility Center. And I also am a professor at George Washington University Medical School, where I tutor and mentor residents. So
You're
I
beautiful.
founded Montgomery Medical Center, and I'd like to share some nuggets with you today.
Yay! We like what you do, Doc. And you've had a lot of publications. You're an advocate for fertility preservation.
Yes.
You're a renowned and recognized awards winner. She's a top doctor since 2012, and she has been recently nominated as one of the women who move in Maryland. A lot of you guys don't shout out yourself. So I was going to do that because you're the bomb.
Thank you. Thank you
Thank you
so
for
much.
all that you do. And my next question to you would be why do you do what you do?
Excellent. So I am one of those people that I just fell in love with medicine from a young age. I fell in love with science from a long, long time ago, and I enjoy people. I love talking to women, and I love helping people who are trying to build their family. So for me, it's a passion thing.
Awesome. And I can tell in how you show up. So this is good. So my next question to you is we're talking infertility. So what is infertility for a woman and a man?
Right. So the key thing with infertility, I always say, infertility is the difficulty in conceiving, right? Or the lack thereof of fertility. The typical definition is trying to conceive for over a year, not achieving it if you're under 35, and if you're over 35, trying for 6 months or more. So any difficulty with achieving that goal, that dream, would be termed infertility.
Okay. Simple enough. Thank you. And then for someone who, let's say someone who's watching who meets the definition, like, yes, I
Correct.
get it. I already know that that's the diagnosis. What
Yes.
are first steps
Yes.
for someone
So
who meets that?
excellent. So I think the first thing is if you've made up your mind or um, that you want to have children and you're not really getting pregnant right away, the first thing is probably reach out to your primary care doctor, reach out to someone like Dr. Olabintan, have that conversation. Oh, sorry, that was my timer to come on the show.
You're good. You're here. We did it.
So reach out to someone and seek help, get help. And I, even though we have this definition that you have to wait, 6 months, a year, stuff like that, I don't always encourage people to wait that long. You don't need to wait the full months. The other thing is, if you are a person of 35, or let's say even 30 and older,
Mm,
and you dream one day that I want children, right? You may not be ready to have the children, but you say, look, in my life plan, when I look 30 years from now, I see myself as a mother, a father, a grandparent. Well,
mm,
if you have that passion, then you might want to take steps to say, how do I safeguard that dream? You don't have to have the right partner, everything in place, but how do I safeguard that dream? And that's where the conversation of fertility preservation comes into play.
So you don't have to wait.
You do not have
You
to
do not
wait.
have to start the conversation. It's not like you're going to be able to,
Early.
yeah, start the
Exactly. Because
conversation.
the tragedy I see is people waiting, and when they're finally ready and they have all these difficulties, right? So that's one problem. Another thing is, and this is common even in physicians like ourselves, you are enraptured with what you're doing. You're busy. You go to medical school and then residency and then fellowship. And then you come out of fellowship, you're trying to establish yourself. So life
Mm,
is busy.
mm,
Life is busy. Professionals, athletes, you want to go win that Olympic in 20 whatever,
mhm,
right? So you got to
mm.
train for X number of years to get there. Please take 2 weeks off. Just 2 weeks. You don't even need to take the full 2 weeks off. 2 weeks to safeguard your dreams.
Mm, mm. I love that. I love that. Take some time off. 2 weeks. It's not going to cost you a whole lot. And prioritize yourself and
Yes,
meet with a doctor and ask questions and make sure you don't wait too long, or too late to start the process.
correct.
Now, what are common risk factors for infertility? And I ask this question so those who are younger who are watching, or those
Mhm,
who are
mhm.
contemplating again, having kids, like what are risk factors that make this more likely so people know
Yes,
to
yes.
avoid them?
Well, there are some things that you cannot do anything about, right? There are some things that are out of your control. Some part of it may be genetic, right? It's out of your control. Um, some things though you can control. What do you expose your body to? What toxins do you come into contact with? I'm a fan of understanding deeply where your eggs come from, how they develop, right?
Mm,
So you're born with a fixed number of precursor cells that will rapidly multiply, right? So when you're about 5 months in your mother's womb, you have the most number of cells. But then you start to lose them because they had divided so rapidly. There's a lot of accidents, mistakes within them. So the body's answer to this is to clean this up, right? So then you start to lose them. By the
mm,
time you're born, you've lost about 4 million. By the time you hit puberty, you've lost an additional almost 1.5 to 1.8 million, right? So then, by the time you hit menopause, you're down to like 1,000. So it's good to say,
wow.
what do you expose your body to in this environment of declining eggs? The toxins you have exposed your bodies to matter. Your lifestyle matters, right? So, sexually transmitted diseases that people don't think about, chlamydia, for instance, can scar up the tubes badly. And people don't think about it till years later when they want to have children and they can't, right? So, you can get tubal obstruction, right? So, what you do, your lifestyle, your diet, your habit, how you take care, folks, listen to Dr. Olabintan. Live a good life. Live a healthy life. Get the proper nutrients, rest, all these things we talk about. At least you may not be able to control everything,
Hmm.
but the few things you can do that is within your power, you can do that much. And then we can talk about the things that are out of your control, right? And that's where medicine comes in to help you.
Mm, mm. I love that. The things you can control, you control. You do your part.
Yes.
I didn't know that you had that many eggs to begin with.
Actually, yes, yes, yeah. Because okay. So, do you want me to do a little deep dive into it?
Yes, please.
Okay. I don't want to be accused of being a nerd.
You're a good nurse. That's good. Nerdy is good.
Okay. So here's the deal. Right after an egg is fertilized, about 2 weeks even after fertilization, right? So when an egg is fertilized, the DNA of the egg and the DNA of the sperm combine, you
Mm,
form a whole 46 chromosomes, new individual. Okay. This new individual starts out as one cell, then two, then four, then eight, and then a rapid growth. In the beginning, the cells are not differentiated. They can become anything. But further along, about 2 weeks or three in, they start to separate out, right? They actually start to separate out sooner. By 5 to 6 days, you get what's called a blast. The part that will be the baby's clumped at the bottom, the part that will be the afterbirth, the placenta is formed around it. Within this conglomerate of cells forming the baby, a few, based on their location, get chosen to be the precursor egg or sperm cells. Those cells migrate to the hind gut area, the lower belly of a growing baby. And within that area, which they will now go to where the ovary will be located, and they start to differentiate. But what happens is those precursor cells, right, the ones that will form the mature egg or the mature sperm, they go from about 40 or 50 of them around 2 weeks. By 9 weeks, they multiply to about 1,000 or so. And then they start to go, imagine a cell just dividing, just chopping it off, dividing. And it multiplies rapidly, okay? And then it stops growing. And then you have this, now you start losing them because the body has to clean up all the ones that weren't formed well. So the one that now passes this check mark end up about 2 million of them at birth. Now, the key thing is those cells have the full complement of DNA, mommy, daddy present, right? 46 chromosomes. In order to form an egg, you have to separate those chromosomes and decrease it from 46 to 23, right? So the egg has 23 chromosomes, because a sperm has 23 chromosomes.
Right.
So that when you combine it, you get a 46 new individual, okay? But in that process of separating it down to 23, it's called a reduction division, meiosis. The funny part about this meiosis is it starts at birth, but then it's halted. And it doesn't resume till the egg is ovulated. You complete part one. Part two doesn't even complete until the sperm hits the outer layer of the egg.
Okay.
Right? So that's nature's way of saying we're not going to get totally ready until we know there's a sperm around.
Okay.
But here's the thing. You pause the division from birth to puberty, and even if you don't ovulate that egg, till menopause or till you die. Now let's take a look at what happens when you pause division, right? DNA is lined up in the middle of the nucleus. Material crosses over, exchanges, and then it starts to kind of pull apart. But then it stops. The mechanism pulling it apart, they look like ropes, like pulley. You ever seen the chain bridge, like the bridge in San Francisco with those cables running out? Well, you have cable running from the DNA to the poles of the nucleus, trying to pull it apart. So those cables are under tension. There's a little winch at the end reeling it in. That's all under tension. And then it's frozen. It's paused. Cryogenics, right? So guess what happens when you pause for 50 years? Imagine if you are playing musical chairs. I'm sure most people played it when they were kids, right?
Yeah.
And you're going around the chairs, and then the music stops. And you're supposed to sit down.
Right.
But instead of sitting down, you sit halfway down, and you sit halfway down for 15 or 55 years. Guess what happens to your muscles and your body? It starts to snap, doesn't it? It starts to creak. I mean, can you wall sit for 15 years? Most people can't even do it for a minute, right? It's like wall sitting, and even worse, it's like me telling you to wall sit, but I take the wall away from your back. So you're going to air sit, and you're going to do it for 15 years. right? So that's where the mechanism that separates the DNA starts to come apart with time. And that's why when those mechanisms don't work well,
Hmm.
then what happens is when the egg is formed and is now ready to fertilize, the DNA is not lined up properly, right? Or the DNA is not there because it didn't get separated. So then you fertilize with sperm, and now you have an abnormal number of chromosomes, right?
Hmm.
What is called aneuploidy, that increases with age. It's not inherited, it increases with age. The
Hmm.
most common one people know about is trisomy 21, right?
Hmm.
But
Hmm.
then there are so many others that are not compatible with life.
Ah.
Now, during that pause, what your body is exposed to can
Hmm.
further fracture those cables, can damage it. What can your body be exposed to? Toxins, free radicals. Yeah, I called it the waste product of being alive, right? Chemicals,
Hmm.
whatever you consume, and most people don't even know this. Medical marijuana is not good for your eggs. We're now seeing that. It's worse for the sperm. Well, guess what? Medical marijuana is prevalent, right? Guess what? Infertility in that population is going up. So I always have this joke that the best place to set up a fertility clinic is actually right next to the marijuana dispensary, right? You can get your fix and come on over and fix your eggs. But anything you expose your body to, chemicals, pesticides, those will wreak havoc on your egg at that very sensitive stage.
Wow. Wow, wow, wow. That's a lot. That was a lot of information. That was good. That was good. It's good to know the process. It's
Mhm.
also good to know and be informed that the things that we do increases the chances of either getting pregnant or
Correct.
not. And
Correct.
so we also have an active role to play. And it's important, the sooner the better, to have a conversation, especially when
Yes.
you know that, you know what, I want to have kids and, time is ticking. It's
Yes.
important to prioritize and not wait till right that moment when you're trying to get pregnant.
Exactly.
Now, Doc, I want you to, if you can, share a story for someone
Mhm.
who's watching, who's like, all
Mhm.
right, Doc, I did the things that maybe I shouldn't have done. I may
Correct.
be a risk factor.
Mhm.
I may have risks for not getting
Mhm.
pregnant. What would you say to that someone who's like, well, what are my chances? Is
So,
infertility curable? Like,
yes.
how do you
Yeah,
encourage someone who's watching?
that's a very good point. Now, your body is very forgiving, right? So you can stop some of these things and give your eggs a chance to recover. Because you see, you don't activate all your eggs at once. Most of your eggs are in that dormant stage. And when they start waking up to complete the process of division
Mm,
prior to being ovulated, it actually takes about 200 to 300 days. They're activated in waves of 15 to 20. We call them a batch. They grow to about 8 to 9 millimeters. When they don't need the brain helping them grow, we call that the gonadotropin, think brain independent growth. And when
mm,
they get to that 9 millimeters is when they become gonadotropin dependent. And that's when the brain can now activate them by FSH and start progressing them towards being selected for ovulation. That initial activation by the brain takes about 75 days, right? It doesn't happen right away. And then
mm,
when they get to a certain point is when they can now be recruited. When they're recruited, I call it selecting a basket of those pre-activated eggs,
mm,
choosing one to ovulate, and then it's going to toss the basket. Now, in the process of when your eggs are being, you know, selected and activated, that 4 to 6 weeks, there are certain things you can do. You can take vitamins, right, that have antioxidants that eliminate the free radicals and help prevent any damage to these eggs that are being woken up in batches, right? You can eat nutritious food that, and I tell people, whatever is good for your overall health is good for your eggs, is good for your sperm. So are you eating fruits, vegetables? So now vegetables, different color vegetables, they all have antioxidants in them. fruits, nuts, berries, fish, certain fish though. Make sure you check the mercury level. Salmon, red snapper, and so on and so forth. So there are certain. And then if you are overweight, try to lose some weight, because we know that when you're overweight, you're going to give off more inflammatory byproducts, right? So if you lose the weight, you are actually helping yourself. So I've had patients where I've talked to, worked with them, and they take it as a life mission, and they come back to see me in 4 months or so, and they've changed their life, reversed it. All those things help. Those help. So it's never too late. If you are a smoker, smoking is not good for your eggs or sperm. You can stop, right? And your eggs start to recover. They start to get healthy. So you can change this. It's not too late. Wherever you are, change it. Improve your lifestyle. And then you get the added benefit of living a little longer. I mean, isn't that something else, right? So it's good for your eggs, it's good for your sperm.
I love it. Whatever is good for you is good for your eggs, is good for your sperm as well. We've talked about eating well. I did not tell her to say this because sometimes I feel like I'm saying this a lot, but eating fresh fruits and vegetables, your nuts, your legumes, your berries,
Yes.
your nuts, these are good for you. You smoke, you stop smoking, maintain a healthy weight, and work towards that. So there's hope. Your body's pretty forgiving, but you got a role to play.
Yes.
This has been good. So we know that infertility is not something that's incurable, depending on what the issue is. It can be prevented, or the risk can be minimized. So this has been very empowering and encouraging, Doc. I really want to appreciate you for taking your time this Saturday morning to do this. And I have people who are watching who are like, you know what? I like this doctor. I like that she's teaching me my own role in the process, even before I decide to actively try to get pregnant. I would like to connect with her. I'd like her to come speak on my platform to encourage other women and men who are seeking to procreate and have children. Doc, where can people find you?
Okay. Several ways. You can email us directly. FAQ, frequently asked questions, FAQMFC@gmail.com. That's a popular way. You can go to my website, MontgomeryFertilityCenter.com, all one word, and you can send us a message directly from the website. Call us. So email us, FAQMFC@gmail, or go to MontgomeryFertilityCenter.com.
Give me that last one again. You said the email is
Frequently asked questions, FAQ, MFC
MFC at Gmail.
at gmail.com.
All right. I'm going to put all of that here. The website, the email, Facebook, LinkedIn, Instagram, YouTube. You are all over the globe.
Thank you. Yes.
Yeah. I love it. I love it. And we'll put it on the comment section. So
Thank you.
ladies, men, those of you who are watching, please share. Karen is sharing, and so forward this to those who will find this useful. This has been awesome. I learned a lot myself. Thank you so much, Doc, for coming. I appreciate you.
Thank you so much.
All right, my pleasure. All right, everyone, have a good one. Thank you for watching live. Thank you for watching the replay. And if you or anyone you know is looking for a thorough, a passionate, and a committed family physician whose passion statement is to help you, or whose mission also is to help you live a better quality and quantity of life, I am she. Have a good one, everyone, and happy Saturday.
Thank you.
Thanks, Doc.